with chiropractic, it's basically removing the nerves. So they get I'm not here to force you to do anything you don't
sure?
want to do.
No, you're just torturing me a little bit.
It looks like that on YouTube. But no, in general, even though you're going to feel like it's uncomfortable, it's going to feel like it's necessary.
Okay.
So that's why you see people, they don't jump off the table. They kind of go, oh God, just go. Like necessary. Let's put it that way. It should feel necessary. Okay? No discomfort anywhere?
Oh, well,
any tightness?
I definitely have discomfort in my neck.
Okay.
A lot of wrestling, stuff like that, so.
Okay.
Yeah. I'm pretty sure once you get in there.
I'll feel things.
You're gonna,
I'm just... Yeah. Anything you want me to particularly adjust, or you just want head to toe?
Head to
just
toe.
Do my thing.
I was pretty excited about the Y strap until I had a conversation.
The Y strap.
Yeah.
The Y strap, I mean, I can do it. It's just, we can do it after everything's said and done, if you still want it. I'm not opposed to the Y strap. It's really good if you're really scarred up. If I find a lot of scar tissue and you need that, then it's good. And especially he would be a good candidate for it if somebody was going to get it.
For the highlight reel of YouTube crack addicts like
of
myself,
course.
It
looks awesome.
It looks awesome. Yeah.
But this is, you know what? I am not opposed to it. I'll do it. But it's not like you won't see me running for it.
You're not selling me on this right now.
I'm not really selling much of anything. The scraping I feel like it helps with the superficial layer. So it'd be like the shirt on top of my arm here. The last kind of smoothing things out. I want the superficial connective tissue to glide. So it makes you feel relief. Now, the skin can be a little sensitive for about 48 hours, but you can still touch it. You can go out in the sun. You can do whatever. I'm not breaking the skin. Okay, I'm not cutting you. All of it is just coming up to the surface of the skin and letting the skin deal with it. The skin is the largest organ of the body, and I like to get the blood flowing going, and whatever kind of stagnation is in there, it will come to the top.
Okay.
Sometimes it's shocking. Sometimes it doesn't look like much of anything. Sometimes a lot comes out, sometimes not much. So if in anything you have any questions, you just let me know. Otherwise, I just kind of do my assessment and...
Let's get started.
Okay. Any other questions? I usually just try to give you the opportunity. And I'm going to do my thing. A little stuck over here, right there. So this is where I would go in and adjust that. Okay, and here's the compensation right here. This should feel better than here.
Yeah, that one kind of sucks.
Right. Now watch when we go up to the Atlas C1. We're going to be up into the skull. Any headaches? Do you ever get headaches?
Nah.
Not too much?
Nope.
Okay. Shoulders, I'm going to check this. Yeah, there's some tension over here. If I push here, is it too painful if I do this?
Nope.
It's okay?
It's good.
See how that's just pressure? It's a lot of this treatment, okay? It's a lot of pushing in.
It's like a deep tissue doing that.
So there's a rib, we push this down. Yeah, there's that right atlas. Not too bad though. Massage first. Good, here we go. Is that ticklish?
No.
Okay. You let me know. I go through and feel all these cables. Okay, cables running north-south. Let your head fall heavy.
Oh, wow.
This is the side that's swollen I was telling you about in the beginning. Right there. Oof. Breathe. There you go. I'm going to use my knuckle a little deep. Okay, yeah. Let me get that little cable. This side feels pretty good. It's all at the top. Just there. Just there. Doing okay. deep breath. Down the neck. Stretch, pull. There we go. Good. All right, you ready for the adjustment?
Sure.
Okay. I'm gonna do this left side first here. Chin back for me. Perfect. Excellent. Other side, breathe. How is that? Is that okay?
That's good.
It's good, okay. And here we go. I got one at the top. Oh, I don't want to go. Right here, think thought. That's all it's gonna go. Oh, it's a little swollen. We'll get it at the end. Feels good though. You got lots of motion.
Is that good?
Yeah, just not too much. The left side, I'll be honest with you, the left side is all swollen. I don't know why, because you have plenty of motion. That's what I'm saying. There's something where you're stretching this left side out. Lots of range of motion now. Yeah.
That was really good.
Yeah, it's nice when that goes. All right, we're gonna do the feet. Okay, that tells me the other end of the story.
Uh-oh.
Tells me where you're placing your weight. Okay. Feels good. Okay, definitely might be this left side. Good. Okay, get the pinky. No. Let's see what this side wants to do. Ooh, that's crunchy. Okay. If anything, you might place a little bit of weight on these toes here, like you roll the foot in. Good. Perfect. Bend your knee. I got you. We're gonna adjust the knee. Good. This corner, back corner. Good. And reach overhead and grab the table for me. Just gonna give me some counter force. Yeah, both hands, perfect. Good, relax the hip. Good. You need another 100 pounds on this chiropractor to get that one. Ooh, wow. That one moved. Why can't I get this one? Hold on. I know why, it just don't. No. The pelvis is rotated. Okay. Do you mind having the shirt off on your stomach? Okay.
Down the hole we go.
Yeah, down the hole. There you go. All right. And hands go on the pads right here. There you go. Just so I don't step on you. Okay. Just tight right here, T5, T10. A little more edema on the left. The paraspinal muscles. It's slight. Anything overly sharp?
No.
Okay. Tight right here. All right, I'm going to adjust this one, okay? So take a deep breath in. Oh, yeah. Oh, I didn't allow you to breathe for that one. Sorry. Very good. Wow, I wasn't sure if that was going to move. It was so tight. But it moved.
That was crunchy.
All right, I'm going to get the upper traps here, okay?
Okay.
Deep breath in. All the way out. Excellent. And again. Perfect. Really good adjustment so far. I know, I'm going to go for here, okay? And again. Wow. Just feeling. These we got to be a little more careful of because it influences the low back.
Okay.
So I kind of go in here and feel. All right. Take a deep breath in. work cut out for me right here. All right, oil, okay? Oh, jeez, oil. Okay. I know, I'll put in my hand first. I usually just so less contact, I just kind of drop it. Scare the living daylights out of you. What's she gonna do now? Okay, just the elbow. I'm just gonna use the elbow, but this is intense. So you let me know.
I will.
Okay, here this is the elbow. It's more like massage for now. Just warm this up. There you go. Yeah, feel that? That's where the scar tissue is. I'm sorry, is that too much?
No, it's not painful at all. It's
Bumpy.
very long. Knots.
Yeah. That's what people call knots, that bumpiness there. The scraper gets rid of a lot of that.
No.
Too much?
No.
Okay. I just go for it. Obviously.
You have my permission.
Okay.
Do your thing.
Okay. There's part of it. Hold this side down. There you go. Good. Excellent. Okay. Starting to loosen up. As we get more blood flow in there, it becomes more pliable. Fascia becomes more pliable. I thought I could do it with one elbow. Nope, gotta use the other one. Too much? There we go, other side. Start you out a little easy. Yeah, look at all that scar tissue. This is just, I don't know, do you bench presses or just using your arms? This is where the arms hook up to the spine. Yeah, so that it's common for there to be scar tissue in here from the repetitive motion of the scapula.
Lots of that.
Right. So when that happens, the body's like, well, I'm going to beef it up and put some scar tissue in. I don't like that, so I'm going to stabilize it. You doing okay?
Yeah.
Okay. Yep, just keep breathing. You're doing good. Like I said, I like to move nerves, okay? Muscles just get in the way. They're just there. I like it when the muscle reacts and pulls the spine straight. That's always nice. Here we go again. You're doing good. That's it. Take a deep breath in. I'm going to really go for this one. A little bit short-term discomfort. Good. Take a break. Same thing, kind of short-term discomfort up here, okay? I'm going to smooth it out. Here we go. Oh, man. I didn't get it all. Sorry. One more. Oh, almost got it. Very good. Oh, my. Okay, I'm going to count backwards from 5. 5, 4, 3, 2. Oh, there it goes. Yay! That's it. You got it. You got it. I'm gonna bounce, okay? Deep breath in. See what more pops and cracks I can get. So I can get that deeper level. Perfect. upper back here, okay? Upper traps. Push my elbow. This is the lid, remember? I'm going to put the lid back on. Very good. Not too bad. See the neck. Feels excellent now. That's all freed up from the adjustment. That feels nice. Okay, got this one corner over here. This one maybe not so nice. Okay, it's a bad one over here. It's a bad one. Ooh, it's real tight. I know I'm gonna roll it if I can. Push the fascia down. That's it. Good. Okay, we're gonna do the shoulder, okay? I'm gonna do this arm behind your back. Right here. Good. I know. There's subscapular adhesions. Okay, so like the body loves to just put scar tissue in here. And your shoulder gets stuck and glued to the rib cage. Can't move my arm. So then what happens? You recruit other things. Usually the shoulder takes the brunt of the pain. Not too much?
No, good.
Okay, I'm going to go with my elbow because I can't. I'm trying with my hand and I'm bouncing right off. Elbow, elbow. Good. That's it. Perfect. Up and around, up and around. Got it. Sorry. Whew. Oh, nice. Other side. There's little bars over here. Careful, careful, careful. And behind you. There you go. Warm it up a little bit. This is like usually the last painful one, okay? Elbow. I'm just gonna go for it. Good. It's like right down this corner. Okay, I'm gonna brace the shoulder. There it goes. You can see his infraspinatus here. You can see the nerve lives right underneath here.
Is that what that is?
Yeah, that's why it burns. Yeah. So when I release that, it's like, oh God. You kind of have to like, as you go over it and you're releasing the nerve, it's firing at the same time. So as long as nothing's going down into your arm, like pain or tingling or numbness, we're okay.
Okay.
If it starts to do that, you gotta let me know.
Pain,
Tingling, numbness, you got it. Because that's the nerve that, if this is compromised, it creates those symptoms here.
Okay.
Does that make sense? As long as you don't feel any of that, then they're fine.
Minor pain?
Minor pain, but pain in the arm.
No.
Just local pain is okay. Because what happens is the nerves exit the neck here, they go down underneath this big bone here, and then they go and feed your arm. So I'm trying to release, this structure here, this one here, to try to give more space for the nerve to flow. So as long as it's not going numb or tingling, we're fine. We're not damaging the nerve.
Okay.
That's why I ask those questions. And then I'm like, can I go for it? Can I just get it? It's like so, it's just right here. Okay, I'm just gonna go for it. I know it'll move. There it goes. Okay. Hard one's over. Oh, we got one up here. This is just overuse. Nothing structurally wrong here. Are you left-handed?
No, I'm a ambi.
Oh, okay. I usually find this over on the right hand side on people.
I'm right dominant.
Mostly right dominant?
Yeah.
Okay. It's here too, but I never find it over here on the left. And I'm like, Unless like there's, somebody plays a sport or something where they're using both hands, but most sports are heavily one side or the other. So I'm like, that's rare. I never find that one over on the left. Okay. I'm a lefty, so I kind of search anyway, even if, like, most people are right. I forget what percentage, 10%? No, what percentage of the population is left? Oh, I think 1 out of every 10.
Hey, Siri.
Hey, Siri, just ask them. And they used to think, it was the brain. Now they don't know. It's definitely something to do with when you're in the womb. It happens before. It doesn't fully solidify until you're like 5 or 6. Because my mom thought I was ambidextrous. And then they kept asking me to pick a hand, and I kept picking the left. They haven't found the left-handed gene yet. Sorry.
I just tickled.
Sorry. My aunt's left and my grandfather's left, but that's about it.
That's 10%.
10%, yeah, 1 out of 10. It's not very common. Oh, I'm sorry. You do not like that. Okay, let's not do that one. Let's do something else. He flinched every time I went over it.
What was that?
It's another... Okay, so let me say this again a little bit more clear. What I'm finding is that this region from T12 all the way up to T7, okay, is locked, but there's no scar tissue. This region from about T6 all the way to T1, the upper thoracic, is plenty mobile, but it's scarred. And the scarring, if I had to take a guess, is from the overwork of the shoulders and the arms, okay? When your scapula and your arms move, this builds up scar tissue. So that leads to restriction in the arm. It leads to it leads to the shoulder not being able to move itself around, and then usually anterior shoulder pain is what it leads to in particular. Okay, pain right there. Yeah. Or pain here. Lesser. Here we go about statistics. About 30% here, 70% here. Okay, depending on the person. So I busted this up and I'm going more superficial up here, like on the surface. I'll come back to it. The scraper will take care of a lot of that. Just right here. This is like your foundation, okay? Like they said, this was the lid. This is the foundation. That's pretty good. A little more swelling on the left. I'm just giving a play-by-play of what I find.
Oh, yeah. I'm all for it.
Okay. Some people are like, I don't care.
I don't know, but I want to.
Yeah, I'm just telling you what I find. I always want to know. Like, ooh, what is that? Yeah. I had to go to school to find out what all that was. That's how much I wanted to know. Why do chiropractors talk so much? Because we want to know. We were once in your shoes, wanting to know what everything was. Now that we know it, we're like, oh, let me tell you. But if you don't want to know, I don't have to.
I don't know, but whatever you're doing is really good.
Yeah, see, this is a nerve, okay? And we're just giving it space, allowing it to breathe. It gets from posture, from standing, sitting, our daily habits, okay? All right, again, oil. I'm going to drop it because it's a dropper. Okay. It's a dropper. It's cold. Okay. They make it look so relaxing, All right, scraper. It's just a blade, okay? But it's not sharp. It's dull. Completely dull. All right, here we go. It's cold. It'll warm up. Your body will warm it up. Breathe. Is it bad?
I feel like you're rubbing butter on my back.
Okay. Kind of. It's just oil. It's so I don't tear up your skin.
And this is what toast feels like.
This is what wood toast feels like. Okay, there might be a little ticklish here in the ribs. You're not bruising too bad. Wait a second. Go somewhere else. Oh no, there it is. As I get into it, it might be a little tender, but it shouldn't be too bad. You okay?
Yeah.
Okay. Because it's bruising now as I get it out of there. Going down to the rib. Yeah, this whole side. Yeah, look at that.
What's up with the left side?
Nothing. A tiny bit. Yeah, if you need to do a push-up or whatever, you've been in here for a little while. So I've made you one with the table. You okay?
I was worried I'd fall asleep and...
Yeah, that's the best part. It's like the icing on the cake because you get into that fascia right there. I know. I'm like, wait, let me go somewhere else. Okay. Let me work through it. How about if I do it like this?
Perfect.
A little slower? Okay. Yeah, let me get a little different pressure. Because it definitely needs it. If we can. And there's the petite coming out.
That feels really good. It's not supposed to smell good, is it?
It's supposed to be all torture in here. It's on a different level, you know? Like, okay, so here I can go on the surface. But here it's just a little bit, it's like a centimeter to an inch down in there. And it can't take this, it's just irritating.
Oh.
So it means I gotta go a little different pressure. Okay. Sometimes I can do it, sometimes I can't. You know, it's whatever we work together here and we get it done. That's it. See, open that rib cage. You should be able to breathe a little better after this. Your rib cage is all going to be opened up here. Yeah, that's it.
Whoa.
So here, and that one's a bad one. I took this whole section.
Very red. Very purpley.
Yeah, it'll cut 7 days. Give me 7 days.
That was good though.
That's what I was.
Like these, I mean, this was super pronounced. And then, like, see that huge one right here. Little piece.
It's tiny on that side. It's not too
Looks
bad.
like I've been barbecued.
Oh my god.
That's what it looks like.
On your side, facing me. Yep. I just hold you because I don't want you to roll off. I'm gonna roll you. You're not gonna fall. Got you. You feel like you're gonna fall?
A little bit.
I got you. I know I look small, but I got you. Good. Another side. Then you're flip over. Chiropractors use really skinny tables,
Yeah.
but they're not wide. And the reason is because I try to get my center of gravity over you. Here we go. Head back, look back. I'm gonna grab your shoulder here. Right here. I've got you. You're not gonna fall. Let it go. Excellent. Come on up and face the windows here. Table. All right. Upper extremities, hands on your hips. Right there, Captain America. I know. There we go. Shoulder down. Elbow's gonna come back and towards my hand, or my, oh, well, it already went, never mind.
Wow.
Let the arm go. Got you. Elbow. Relax, lean away, wrist. I don't crack, I don't bend them or anything. I'm just straight axis. Perfect, there you go. Lean away from me. Here goes. Perfect.
Learn some technique here.
A little aggressive. Being a chiropractor, yeah. All right. You want the Y strap?
Oh yeah.
I don't think. I gotta tighten this down. All right. How's it feeling? Nothing choking you?
No.
Okay. How's it feel in the neck?
I feel pulling.
Okay. Take a deep breath in. And again. Breathe in. That's
Whoa.
it. Don't move. if you wanted to do.
Okay.
All right. Do you want it again? You can do it more intense. Or are you good?
Yeah. We can do it again.
Okay.
Sure.
Feel okay again?
Mm-hmm.
Deep breath in. And again. That's it, right there. I felt it that time.
Whoa.
Stay there.
Is it normal? I can't feel my fingers. Is it normal? No, I'm just kidding.
I've never had that happen, so usually they're lying when they say that. We usually say, oh, you know, Dr.
That was
Gregory
like
Johnson.
Sorry,
Sorry, Dr. Johnson, I had to do it.
I'm fine. I think.
That was good. Yeah, I felt some stuff move.
I felt a lot of stuff move.
Yeah, I was like, oh, he's a good candidate. You would be a good candidate.
That was good job.
But I think if you have the scar tissue that you have, it, especially here.
Yeah.
Yeah.
The first time you pulled it.
You will feel it ripping that. I mean, I feel
So
the
the
bones
second time?
move. The second time, yeah. What happened the second time?
Like it felt
That's
like.
a deeper level.
Yeah, it went like to
You'll go to the
to the
lumbar.
T section. Yeah.
Lumbar. Yeah.
Yeah.
That's
so
if you
that-
want it to go the whole way. Then you hold the legs down.
Okay.
First, we do a test run with the baby one first.
I kind of messed with my neck and adjusted myself. Nothing like it feels nothing like what you did.
Which, well,
In a good way.
no two adjusters are the same.
Yeah.
Like if you go see another chiropractor, it won't feel the same as the way I did it. We're all different.
Oh yeah.
Yeah, we all have different ways. We haven't really gotten it down to, okay, step 1, step 2. Like, actually we have, but we still don't adjust the same way. None of us do.